Hello madam, welcome to the podcast today.
Thank you.
Generally women కి ఏమైనా ప్రాబ్లం వస్తే gynecological problems వస్తే they go to gynecologist.
Basically, gynecological cancers are reproductive tract organs.
And many people don't know what Gynec Oncology is.
అలా ఏం కాదు.
One major question is, does it affect only women?
So HPV అంటే it is basically a virus. అందరిలోని ఆ HPV ఇన్ఫెక్షన్ ఉంటుంది.
Okay.
It's really important in women who are living with HIV.
Okay. Government is conducting HPV vaccination camp in Karnataka and Kochi. It's like lifestyle habits ఎంతగా affect చేస్తాయి, like
Obesity and alcohol, they don't have
much
impact on HPV.
Cancer is like a very major problem in people these days. A very common problem.
Organs లో వచ్చే cancers like the cervix, uterus, ovary, vagina and vulva. Why gynecological cancers are
Hello madam, welcome to the podcast today.
Thank you.
Yeah. So before getting deep into the topic, so generally women కి ఏమైనా ప్రాబ్లం వస్తే gynecological problems వస్తే they go to gynecologist. But so you have been into gynecology and now you are a Gynec Oncologist and many people don't know what Gynec Oncology is. So can you just take us through your journey, like what is Gynec Oncologist do and what is it?
Thank you, Omsi. And so basically Gynec Oncology, past 15 years I think, we have a special program called M.Ch in Gynec Onco, where we are post obstetrics and gynec training in post graduation. There is this M.Ch program where they train us through the gynecological cancers. Basically gynecological cancers are reproductive tract organs. Organs lo vache cancers anamata, like the cervix, uterus, ovary, vagina and vulva. So over 3 years it is not just the surgeries that we are trained in. These surgeries also, like cytoreductive surgeries or any staging laparotomies or fertility sparing surgeries, ivi kakunda we also specialize in something called a preventive oncology, wherein we treat also the pre-invasive lesions. We do screenings, and what if they are screened positive, what are we supposed to do? So basically gynec oncologists are a super specialist, I would rather call. Whole of gynecological cancers, be it screened positive, or if you're diagnosed or you're suspicious for cancers, or after treatment what adjuvant therapy they need to, they can probably be guided the best through a Gynec Oncologist.
Okay. So ma'am, gynecological cancers ante, so cancer is like a very major problem in people these days. A very common problem per se. But last many years నుంచి people have seen lung cancers, bone cancers, అలా చాలా types of cancers చూసారు కానీ but gynecological cancers they have been heard very recently. So what do you think is the reason? ఈ మధ్య పెరగడానికి కారణం ఏమైనా ఉందా, లేకపోతే ఇప్పుడే జనాలకు తెలుస్తుందా?
అలా ఏం కాదు. ఇంతకు ముందంతా cervical cancer was the most common cancer among women. Why gynecological cancers are behind the screens was probably because women, the tolerance that women have, they don't come up that fast to a healthcare setup, or they don't like to express themselves that they have these problems, and they don't visit the hospital probably because of the fear of judgment that women will rather face. So that is probably the reason. But right now I think everybody knows about cervical cancer, HPV vaccination, because of media or whatever. Most of them are aware, but then it is only till awareness. They don't want to go and get screened or vaccinated. That is the problem that we face now. But unlike other cancers, gynec cancers, they comparatively, if they are diagnosed at an early stage, they do pretty well.
Okay.
They can have near normal life once they are treated.
Okay.
So I think apart from breast cancer, second most common vachesi cervical cancer. Cervical cancer is one of the only cancers which is completely preventable. Okay. Because that virus that we were talking, human papilloma virus, it has that window period anamata. Ippudu nenu vachi attack chesananna daniki adi cancer kinda maaradaniki at least 20 years window period istadi. ఆ విండో పీరియడ్లో మనం స్క్రీన్ చేయగలిగితే వీ కెన్ కంప్లీట్లీ ప్రివెంట్ దెమ్ ఫ్రమ్ గెటింగ్ దట్ క్యాన్సర్. సో దట్స్ వేర్ cervical cancer can be totally eliminated అనమాట. Like how we all took steps to eradicate polio, one day I don't think that day is very far where we see cervical cancer is eliminated.
Yeah.
but it needs all the efforts by everybody, in fact, not just at the level of doctors or community health workers, but also media and women self-help groups kani, women in small associations, they should be talking openly about these about how they can get screened and all. It should not be a taboo for them.
Oh yeah. So హెచ్పివి కోసం మాట్లాడారు కాబట్టి మేడం, సో గివ్ ఎ లైట్ ఆన్ హెచ్పివి బికాస్ సో మెనీ పీపుల్ లైక్ ఇట్స్ బీయింగ్ హర్డ్ ఇన్ న్యూస్, బీయింగ్ హర్డ్ ఇన్ సోషల్ మీడియా అండ్ ఆల్. సో హెచ్పివి అన్నాక మెనీ పీపుల్ స్టిల్ డోంట్ నో వాట్ హెచ్పివి ఈస్, వాట్ డస్ ఇట్ కాస్, అసలు హెచ్పివి అన్నది ఏంటి, దాని అదే ప్రాబ్లమ్స్ క్రియేట్ చేస్తుంది. అండ్ వన్ మేజర్ క్వశ్చన్ ఇస్, డస్ ఇట్ ఎఫెక్ట్ ఓన్లీ ఉమెన్ ఆర్ ఇట్ ఎఫెక్ట్స్ మెన్ టు? సో వాట్ ఈస్ ఇట్? సో గివ్ ఎ లైట్ ఆన్.
So HPV అంటే it is basically a virus, human papilloma virus, and just like any coronavirus or a HIV virus. So HPV is the most common sexually transmitted infection అన్నమాట. Through skin to skin contact అది spread అవుతుంది. And this HPV infection, it not only causes cervical cancer, it also causes vagina లో వచ్చే cancers కానీ, vulva-లో వచ్చే కొన్ని cancers కానీ, or anal cancers కానీ. Women-లో ఇవి కాకుండా, apart from these, it also causes something called genital warts. Basically, HPV is a family.
Okay.
There are many subtypes of HPV. Like 6 and 11 HPV viruses are responsible for genital warts. 16 and 18 are the most notorious of all the HPV family, in the whole family. Where 16 and 18, nearly 80% of cervical cancers, squamous cell carcinomas, adenocarcinomas, are responsible for cervical cancer. And men-లో penile cancers, though it's very rare, but penile cancers కి కూడా హెచ్పివినే కారణం. ఇంకొకటి ఏంటంటే కొన్ని థ్రోట్ క్యాన్సర్స్, వీటన్నిటికీ హెచ్పివినే కారణం. అండ్ వన్స్ a lady starts her sexual debut, and most of the times it is transmitted through contact, they harbor this infection. So nearly, if you see in the active reproductive age group women, ఒకవేళ మనం తీసుకుంటే అందరిలోని ఆ హెచ్పివి ఇన్ఫెక్షన్ ఉంటుంది.
ఓకే.
బట్ ఇట్ ఈస్ నాట్ దట్ అందరికీ ఆ క్యాన్సర్ కింద మారదు, ఎందుకంటే బాడీ ఇమ్యూనిటీ విల్ వాష్ అవుట్ మోస్ట్ ఆఫ్ ద వైరసెస్. 80%, yeah, nearly 80-90% based on your immunity, it completely gets washed out. That's why HPV screening and vaccination is really important in women who are living with HIV.
Okay.
So in them, because the immunodeficiency valana, they manakandariki ipudu SAGE recommendation ante strategic advisory group of experts, WHO em cheppindi 2 single dose vaccine kuda parvaledu ivvachu ani until 20 years. But for HIV, it's the WHO also says you have to give the complete dose.
Okay.
And even screening frequency kuda vallaki frequent ga call cheyamani antaru.
Okay. For HIV
because their HPV infection is not really cleared out, because the immunity of their body is so low that they can't clear the infection.
Okay.
So ఎన్ని రోజులైతే మన బాడీలో అలాగా హెచ్పివి ఇన్ఫెక్షన్ ఉండిపోతుందో, there is more chance that it will get into your DNA and into the host DNA and then start multiplying.
Okay.
That's when the pre-invasive lesions అంటే CIN1 కానీ 2 or 3 ఆ తర్వాత malignancy కింద కన్వర్ట్ అవుతుంది. So HPV gives that time. Okay. That okay, you detect me, you treat me అన్నట్టు.
So HPV gives the time for us to act against it.
Yeah.
Okay. So how do we detect it, ma'am? అంటే ఇప్పుడు does it have any symptoms? ఇప్పుడు మనకి ఫీవర్ వస్తే కరోనాకి it has some symptoms, so some other problem has some other. So HPV does have any symptoms?
Unfortunately, early stage of cervical cancer, you won't have any symptom. Okay. And unlike breast cancer, at least some or the other day you will get to know that you have a breast lump or you have some abnormality in your breast. Cervix can't be seen by the ladies. Okay. So only when they are in their advanced stages they get to.
So the moment we identify it, it is already problematic and we are already in danger.
Yeah, you are already into the second or third stage.
Okay. So what do we do against it? So
ones who feel that they are absolutely fine, that's wrong.
Okay.
You may not have the symptoms like I told you, they develop at a later stage, like having intermenstrual bleeding, ante periods ki madhyalo unna vastunna spotting ani bleeding ani, that is one feature. And then having bleeding after intercourse, postcoital bleeding antam. They are all symptoms that develop like at a later stage, and continuous white discharge, foul smelling discharge, or a pelvic pain, or even advanced stages లో ఏంటంటే where the urine or motion is passed through vagina, fistula develop అయ్యి. So these are symptoms that I don't think anybody should wait for. The screening ante, what is the importance of a screening where any apparently normally appearing women are screened? They might harbor that infection or a CIN or a pre-invasive lesion అని అంటాం. So such people need to be caught hold of and treated for these lesions. If once you treat a CIN2 or a CIN3, they can be very very sure that they don't need to worry that it will go into cancer. But they have to be under follow-up, but it is treated. Instead of going into radiation and facing all the side effects of a radiation or a cancer treatment, chemotherapy, or at certain stages like stage 4 when it becomes palliative, ante only supportive care. You're not treating the cancer, you're not curing the cancer, you're only giving the supportive care. Then instead of going to that extent, when you can get rid of it at a very very early stage. Or even before a cancer develops, that's the best thing kada.
Yeah. So do we have any screening schedule for people, or is there any age limit, or like when should women start getting screened, or when should men start getting screened?
Okay, women after 30 years it is the recommendation, 30 to 65 years. In fact, WHO in 2018 when it came up with the cervical cancer elimination strategy, it says at least 2 screenings between 35 to 45 is also enough. Okay, but ideally if you want to get screened, it depends on what health setup you're in. Like in a rural setup where the lady does not have access to a hospital or a pathologist who is trained in identifying an abnormal smear or a pap smear, or if there is no facility for HPV testing, then there is something called a VIA test. Visual inspection with acetic acid. What happens in the vinegar that we use at home, same thing, 5% acetic acid is applied on the cervix, and we see for aceto-white areas. Basically these aceto-white areas are the areas where there is active replication. Ante DNA fast ga multiply avutundante adi క్యాన్సర్ కింద మారే అవకాశాలు, లేకపోతే సిఐఎన్ హార్బర్ చేసే అవకాశాలు ఉంటాయని ఆ విఐఏ టెస్ట్ చేస్తాం. అదేంటంటే చూడంగానే యూ గెట్ టు నో ఓకే షీఈస్ విఐఏ పాజిటివ్, దెన్ షీఈస్ రెఫర్ టు ప్రైమరీ హెల్త్ సెంటర్ నుంచో లేకపోతే కమ్యూనిటీ హెల్త్ సెంటర్ నుంచో అక్కడికి రిఫర్ అవుతారు, ఆర్ టు అ డిస్ట్రిక్ట్ హాస్పిటల్ దట్ దే ఆర్ స్క్రీన్డ్ పాజిటివ్. సో దాట్స్ వన్ థింగ్ విచ్ డస్ నాట్ నీడ్ మచ్ ఇన్వెస్ట్మెంట్, బట్ ఇట్ ఆల్సో హ్యాస్ ఇట్స్ ఓన్ లిమిటేషన్స్. అండ్ నెక్స్ట్ థింగ్ ఈస్ డూయింగ్ అ pap smear. Pap smear is where you collect the cells into a small slide or into a container, and the pathologist will observe the cells and see if there are any changes of HPV. ante emana nucleus peddaga unnada lekapothe emana abnormalities emana cells lo unnaya ani chustaru. Next thing, even pap smear ante once in every 3 years is fine. And next best thing right now is getting a HPV DNA test. So HPV DNA test kuda you shouldn't get it done from any lab. There are few WHO certified machines like the Cobas or GeneXpert, or so those are the ones which are approved for HPV DNA testing. No, not any homegrown PCR. So those if you get a HPV DNA test and if it is normal, that means it is not detected, then every 5 years.
So we have time limit for screening as well. So do we have any solution for men, like to get screened or something like that?
Men is predominantly I feel it is the oral cancers, because men is not much in Andhra, but towards the north and western parts of our country, they're all used to chewing tobacco. So their oral screening plays a major role. So they all screen them for leukoplakias or any pre-invasive lesions. The screening for men play a role, and also ones who have a habit of smoking, again CT of lung also helps.
So ఇప్పుడు ఇంత ఎఫెక్ట్ చేస్తుంది కాబట్టి how do you think like it is being so how educated are people to get screened? So you have told this, now our listeners will know, but in an urban setup or in a rural setup, like how many people know like we have this type of problems, we should get screened, or how much like public doctors or in general clinics, like doctors know we have this type of problem, we should refer this case to a gynecologist or a gynec oncologist for proper treatment?
No, actually, there is a very huge gap between the knowledge and into women going. So, and another problem that we face with women in the urban setup. Recently, we had a screening camp where this lady was very well educated. Though she was screened positive, but she never came for follow. So, women who are really educated or working women, we face this problem because they are in that denial phase that they can never harbor HPV.
Just because they don't have symptoms,
They don't have symptoms, or
realize
they
it.
don't want to come. They feel the cancer can never affect them, but it is not like that. It can be to anybody. So this is the problem that we face. And women who in rural areas, that's another. They don't have access for
They don't
screening.
access for the screen. Okay.
They don't have access, or they are in remote areas. It is very difficult to go and screen such women, or to call them for follow-up. It becomes really difficult.
Okay. So are there any government initiatives taking place? Because last 1 week or somewhere I've seen 2 news articles where government is conducting HPV vaccination camp in Karnataka and Kochi in Kerala as well. So how effective is government in doing this? So one thing is HPV vaccination for like young kids and all, but screening should also be given equal importance is like what I understood. So how effective government is in this?
So now that we have our own vaccine, like the Cervivac produced by the Serum Institute, the cost has come down. Like previously, we used to spend some 3,000-4,000 rupees for a Gardasil or a Cervarix. Previously, there was another vaccine called Cervarix, but because we have our own vaccine which was developed, the cost has come down to literally less than 2,000 rupees. Okay. So that is one very big thing. I mean, best thing that has happened in the recent years.
So vaccines, so screening.
Screening.
Vaccine camps are being conducted. So equal importance should be given to screening is what I understood. So in the age people, vaccine may not be that effective. We should get screened. So are there any initiatives being taken by the government?
So there is we have the non-communicable disease program in India, where recently also we had with the Swasth Nari Sashakta Parivar, where everybody, because of Narendra Modi sir's birth date, started from September 17th, I think, and then till October 2nd we had awareness programs. So government is also trying its best to bring more awareness among but then it is not completely possible for the government. With such a huge population that we have and so many women, the target population is so high. It is always better that we do along with the government and the NGOs. So it is always, I think, a public-private partnership is the best way to go forward, because it is a huge task for the government to take it forward.
So lifestyle habits. So many diseases ki ఇప్పుడు ముందు జనరేషన్ కి ఇప్పుడు మా జనరేషన్ కి lifestyle has changed a lot. Our habits, even in terms of work గానీ studies గానీ, it has changed a lot. So how effective is like lifestyle habits ఎంతగా ఎఫెక్ట్ చేస్తాయి like to be prone to HPV?
HPV, like I told you, is basically transmitted sexually most of the time. So lifestyle factors are really important for breast cancer or an endometrial cancer, the uterine cancers, and colorectal cancers, not for cervix. But cervix, there are risk factors like, multiple sexual partners or women getting married at a very early age. So they're more prone for repeated HPV infections. They become sexually active at a very early age, right? So or having many childbirths, because the cervix again undergoes every childbirth. The cervix undergoes the repair and tear. So in that that is the nidus for the HPV to come and get attached to your DNA. So repeated childbirths and trauma in those areas, and immunodeficiency like we discussed, and smoking and all are common for all the cancers. But so these are the factors which are for cervical cancer. Unlike breast cancer, they're totally opposite.
Okay.
Right. So for breast cancer, nulliparity or those are the risk factors. So and obesity and late marriages and not breastfeeding. On the contrary, it is different here in cervical cancer.
So it doesn't affect much. So ma'am, so after getting into all this, so family history, let's say if a person is diagnosed with HPV, సో అది ఇప్పుడు ఇట్ గాట్ ఇన్ టు జీన్స్, సో అది ఫ్యామిలీని సో నెక్స్ట్ వాళ్ళకి ఎఫెక్ట్ అయ్యే ఛాన్స్ ఉంటుంది. హౌ డస్ ఫ్యామిలీ?
No. There is no significance of family history in cervical cancer.
Cervical cancer.
It is totally and totally because of the transmission of this virus. That's it. It does not have any. So many of them who are actually diagnosed with cervical cancer, they all have this fear that they'll not be made to allow, to play with their grandchildren, because that is the age in their prime women are tested positive for cervical cancer, like between 40 to 50 years, and most of the women would have had their grandchildren by then. So that is not at all transmitted by family. In the family. It is completely because of the infection.
సో ఇఫ్ దిస్ ఇస్ లైక్ ఫ్యామిలీ హిస్టరీ ఎఫెక్ట్ అవ్వకపోతే, సో ఇప్పుడు హౌ లెట్స్ సే పర్సన్ ఇస్ డయాగ్నోస్డ్ విత్ హెచ్పివి, సో వాట్ ఆర్ ద ఛాన్సెస్ ఆఫ్ హర్ బీయింగ్ ప్రెగ్నెంట్ అయ్యాయి? సో కన్సీవ్ అవ్వడానికి తర్వాత ఛాన్సెస్ ఎంత వరకు ఉంటాయి? డస్ ఇట్ ఎఫెక్ట్ లైక్ ప్రెగ్నెన్సీ?
You mean to say HPV or cervical cancer?
హెచ్పివి.
HPV, if the diagnosis, or if you are detected by HPV, if you are screened and you have been told that you have HPV, that doesn't mean you have cancer. That does not say. It is just that telling you that you have this infection. How much is the severity, you will only get to know by doing additional test, or you do a pap smear later on, or you do a colposcopy and see where the cervix is infected with by, like I told you, the estovite areas or certain areas which gives us clue, and the colposcopists will have certain scoring systems where they will have an idea that this could be the area for biopsy or for treatment. So they are completely they do not affect pregnancy at all. No, only when you get treated for CIN3 or early cervical cancers, that's when the length of the cervix becomes shortened. So they will not have difficulty in getting pregnant, but they might end up in preterm births. Because the cervix is like the door of the uterus, so it might open up earlier, or there can be cervical incompetence. So that is the only thing. But per se it will not affect her chance of getting pregnancy.
So during like you have been working with women closely for the past few years in terms of preventive care and all. So what are the general misconceptions you hear a lot? Like, so you might have heard a lot like in these years. So what are the general things?
So most of the times that problem that we face was overall, if I see, we would have screened lakhs of women, but they all feel that they're absolutely fine. They don't want to come for screening. That's one major problem. To bring them for screening is a problem. And then if they are screened positive, for them to bring back for follow-up or for the additional test, it's not just the cost, but they also have that denial that they cannot be tested positive, or they have that fear that they probably might be detected for cancer. Or they also have this fear of coming to a hospital, or the taboo or the stigma that is associated. They feel if they are tested positive for HPV, that means they have a cancer. No, that's totally wrong. You being tested for HPV and you are detected positive, or your pap smear is abnormal, it does not mean that you have cancer. There are measures where the gynecologist or a Gynec Oncologist can definitely help you in staying away from cancer and treat you accordingly.
So madam, ఇప్పుడు సో స్క్రీనింగ్ చేసిన తర్వాత ఫాలోఅప్కి మళ్ళీ పేషెంట్స్ని తీసుకురావడం, ఇట్ ఈస్ బీయింగ్ ఏ ఛాలెంజ్ ఫర్ యూ యాజ్ ఎ డాక్టర్. అండ్ ఫ్రమ్ ద గవర్నమెంట్స్ పర్స్పెక్టివ్, ఇంత పెద్ద పాపులేషన్లోని టు ఐడెంటిఫై అండ్ స్క్రీన్ పీపుల్, లైక్ అర్బన్ పాపులేషన్లో అయితే రూరల్ పాపులేషన్లో స్క్రీన్ చేయడం ఇట్ ఈస్ వెరీ డిఫికల్ట్. బట్ నాకు లైక్ వాట్ ఐ నో ఈస్ వెన్ యూ ఐడెంటిఫై అ మలేరియా కేస్, సో ఇట్ ఈస్ బీయింగ్ రిపోర్టెడ్ టు గవర్నమెంట్. సో వెన్ యూ ఐడెంటిఫై డెంగ్యూ కేస్, ఇట్ విల్ బీ రిపోర్టెడ్ టు గవర్నమెంట్ is what I know. So అలాగా if you identify HPV positive case, if you identify it to government, so people would listen to a government in a more అంటే నమ్మకంతో ఇంకా వింటారేమో గవర్నమెంట్ చెప్తే, బీయింగ్ ప్రైవేట్ డాక్టర్ కన్నా అలా అని. సో హౌ డూ యూ థింక్ దట్ ఐడియా వుడ్ దట్ బి ఎఫెక్టివ్ ఇఫ్ గవర్నమెంట్ డస్ దట్?
Actually, one major problem that the government right now, or most of the doctors, are preoccupied with the curative treatments, because they either pregnancy unkontrolled, most of the government hospitals, they are like overwhelmed with the obstetrics job that they have.
Okay.
And even private hospitals, they are what we lack to see is the preventive if we are able to prevent someone from getting that particular cancer, that's the best cost benefit
Okay.
thing that anybody
Even
can
can
have,
have.
including the government. So that's one thing that I think even the government needs to focus on. And coming to HPV testing, not many centers have
Proper equipment
proper
setup.
equipment or HPV testing. Very,
Okay.
very high, like the maybe few regional cancer centers, they all have. Oh, that too I also know because I studied from GCRI only in 2022, 2023. I think they had this HPV detecting machine. So most of the government institutes also now of late, they are all replacing their instruments into recent ones, but most of the institute, they don't have HPV detecting
Detecting setup with them.
set up with them.
Okay.
So even right now, even government focuses on VIA
Yeah.
because it is very cost effective.
Cost effective and very like that can be done anywhere. Okay.
But VIA also has its drawbacks, because for you it is very subjective, and not everybody we can do VIA. Like for postmenopausal women and all, VIA can't be done. Because of the hormonal changes that happen in the lady, the
It doesn't give good results.
cervix won't have that area, what we call transformation zone.
Okay.
You won't be able to see at all.
Okay.
So VIA doesn't make sense in such women. So VIA in only young women, it plays a role.
Okay.
But to be cost effective, that is
That
the
is
way.
the only option. సో మ్యామ్ ఇప్పుడు వ్యాక్సిన్స్లో కూడా ఇఫ్ ఐ వాంట్ టు గెట్ హెచ్పివి వ్యాక్సినేటెడ్ దెర్ ఆర్ లైక్ మల్టిపుల్ ఆప్షన్స్ అవైలబుల్ ఇన్ ద మార్కెట్ రైట్ నౌ. సో ఈస్ దెర్ ఎనీ స్పెసిఫిక్ వన్ విచ్ ఇస్ ఎఫెక్టివ్ ఆర్ విచ్ ఇస్ లైక్ కాస్ట్ ఎఫెక్టివ్ ఇన్ టర్మ్స్ ఆఫ్, లేదా ఇప్పుడు ఈ వ్యాక్సిన్ మెన్కి ఎఫెక్టివ్, ఇది ఉమెన్కి ఎఫెక్టివ్, లేకపోతే అలా ఏమైనా ఉందా అసలు?
There are currently in the market, in Indian market, there are 3 vaccines. One is Cervical, which we discussed earlier, which is the Indian vaccine, the indigenous one, and the other one are the Gardasil 4 and 9 by the MST. So this vaccine has been there since 2006.
Okay.
It was brought into market in 2006. So they're absolutely safe, and it does not. I feel like taking the vaccine is more important than choosing which vaccine you want to take.
Okay.
So it depends on whether you can afford a nanovalent vaccine. You should go ahead because it prevents you from getting 9. Like we discussed previously, there are many types of HPV viruses. So nanovalent prevents from 9 different types of HPV viruses. Likewise, the Cervical and Gardasil 4, it prevents from 4 different types of HPV viruses. So more or less, they're all the same in the way they act and all, but just that there is an extra prevention factor in Gardasil 9 compared to Gardasil 4 and Cervical. That's it. But if it comes to which vaccine to choose, it is best to take a vaccine than not to take it.
Not to take. Yeah, it's a good nice ma'am. So like ma'am, we have a very good discussion. So you have given like so much light to us on HPV and like what a gynec oncologist does. Because we like I've been around doctors for the past few years. Even I don't know there's a gynec oncologist specialization undani నాకు తెలియదు until like I met you. So now this has been very good. So if you want to tell something to our listeners.
సో నాకేమనిపిస్తుంది అంటే క్యాన్సర్ అని ఒకరికి డయాగ్నోజ్ అయ్యాక ఇట్స్ నాట్ లైక్ డెత్ సెంటెన్స్. దర్ సో మెనీ థింగ్స్ దట్ పీపుల్ నీడ్ టు బీ అవేర్ అనమాట. ఎవరో ఒక లేడీ స్క్రీన్ పాజిటివ్ అంటే అమ్మో నాకు క్యాన్సర్ ఉందో అనో, లేకపోతే క్యాన్సర్ ఉంటే ఏమవుతుంది అని, లేకపోతే ఏం ట్రీట్మెంట్స్ తీసుకోవాలని, అలాంటి ఫియర్ కన్నా ఇట్ ఈస్ ఓపెన్గా డిస్కస్ చేయగలగాలి. విమెన్ ఇన్ స్మాల్ గ్రూప్స్ దే షుడ్ బీ ఏబుల్ టు డిస్కస్. అలాంటివి కాకుండా గవర్నమెంట్ నుంచి కూడా దే షుడ్ బీ సపోర్టెడ్ దట్ ఒకవేళ వాళ్ళు ఏమైనా స్క్రీనింగ్ టెస్ట్ కానీ దీనికి వెళ్తేనంటే వాళ్ళకి సపోర్ట్ చేయగలగాలి. సో దట్స్ వాట్ ఐ ఫీల్. అవేర్నెస్ ఒకటి, నాకు క్యాన్సర్ రాదు అనే ఆ డినయల్ కన్నా అందరం స్క్రీన్ చేయించుకోవడం, అందరూ ఇఫ్ అ మదర్ బ్రింగ్స్ హర్ డాటర్ ఫర్ వ్యాక్సినేషన్ అండ్ మదర్ గెట్ స్క్రీన్డ్, ఇంకా అంతకన్నా బెటర్ థింగ్ ఏంటి? we will not be very far from elimination of cervical cancer.
So yes, thank you so much for this, madam. So we have a very good time. So future lo like all the best for your screening camps for the initiatives as well.
Thank you so much. Thank you so much.
Thank you.
Mm.